very good evening to you and welcome to the National News Broadcast. I'm Sharifa Tahir.
Good evening, I'm Clifford Richards. First of all, we take a look at the headlines.
The isolation status in 6 housing schemes in Colombo has been withdrawn. The series of women's conferences of the Sri Lanka Podujana Peramuna commences under the theme Siu Desa Suraki Siu Wasara. A decision to continue the functioning of the Ministry of Justice in the existing building itself. The worldwide corona deaths surpasses 1.6 million. The number of infected increases to 71.5 million. Donald Trump's struggle for presidency ends with the rejection of the elections petitions by the Supreme Court.
Moving on to the stories in detail. 6 housing schemes in the Colombo district were exempted from isolation status at 6 o'clock this morning. Head of the National Operational Centre, Army Commander Lieutenant General Shavendra Silva says this decision was based on the results of PCR tests conducted in these housing complexes. Isolated status in the housing schemes of Randi Uyena in Mattakkuliya and also Metsanda Uyena and Mihijaya Sevana in Mutual, Moduru Uyena and also Samagipura in Grand Pass and Mihindu Setpura Uyena in Demataguda have been withdrawn.
Since this morning, the quarantine order in respect of 6 condominiums had been lifted. However, these condominiums are situated in lockdown areas. So therefore, the inmates of the condominiums, they can come out, they can move in the premises of the condominium area. However, they cannot move on roads as usually and they cannot go on three-wheelers. They are not able to open up shops because quarantine isolation order is being implemented in that particular respective police area. Therefore, we would like to express our sincere appreciations to the inmate who obeyed with quarantine rules and regulations, especially the isolation order, for a period of almost 45 days. However, they have to again adhere with the blanket quarantine order in respect of that particular police area. So therefore, they cannot move as usually on roads and other areas because those areas have been locked down.
Extensive travel restrictions have been imposed in 7 villages in Galle. They are Miliddua, Koongaha, Thalapitiya, Dangedara East and Daddugoda North and South in Makulua. Shop owners and employees in the Kalutara town were subjected to PCR tests with the objective of safeguarding security of consumers during the forthcoming festive season. 9 shops in the town have been closed down based on the outcome of the tests. The police and health divisions requested general public to restrict travelling in the upcoming festive season as well.
Convey a message to everyone, especially how do you behave in the festive season. Now the festive season is coming all the time. You have to adhere with quarantine rules and regulations while you are on shopping or moving on public transportation, leaving Western Province or Colombo district. All the times kindly adhere with quarantine rules and regulations and render your fullest support and cooperation in order to control COVID-19.
The Ministry of Health says that the number of fully cured COVID-19 patients has increased to 23,304. The percentage of complete recoveries is 72.81. The percentage of patients still undergoing treatment is 26.73. 6,314 fully recovered patients were discharged from the hospitals from the beginning of this month till today. 17,425 tests were conducted yesterday. This was the highest number of tests conducted in the country on a single day. Accordingly, the total number of PCR tests carried out so far has reached 996,822. 632 more corona-infected patients were identified today. Out of this number, 551 were reported to be close contacts of the patients of the Palyagoda cluster. The remaining 81 patients belong to the close associates of the prison cluster. 473 fully cured patients have left hospitals today. Meanwhile, another COVID-related death was reported yesterday. The victim is an 82-year-old woman from Colombo 13 who was undergoing treatment at the ICU of the Mulariao Base Hospital. The death was attributed to high blood pressure associated with COVID pneumonia. Another group of persons stranded overseas due to their inability to return to the island as a result of the pandemic were brought back today. The group included 884 persons who have been detained in the UAE, Qatar, Doha, Singapore, Dubai, India and London. They were subjected to PCR tests at the airport premises itself and later on directed to quarantine centres.
Chief Epidemiologist Dr. Sudat Samaraveera said that health regulations and guidelines are purely designed to contain COVID-19 pandemic. Addressing a press briefing today, he further said that any specific community or religion is not targeted with COVID-19 health regulations.
Now, there are many discussions going on where COVID-19 prevention measures are targeting at a certain communities like Muslim communities because that some of their religious that practices has been restricted because that dead bodies are cremating, not allowing to burial, and also that in some Muslim communities, Muslim villages that we are detecting cases and people are thinking that we are targeting only the Muslim communities. We can't control a disease that targeting a certain fraction of the society. Actually, that what we are doing is that we study the disease spread, we see where the disease is spreading and that we targeting on that. Even for this cremation of the dead bodies, that the decision has been taken after expert opinion. That experts, not only the medical expert, even the experts on water and soil has given their opinion, and based on that only that the decision has been taken that it is the cremation is mandatory. But the science is evolving. If new evidence are coming up and in contrary, that will be that evaluated, that actually that we are evaluating all the medical evidences very regularly and that we are updating our knowledge and our practices. Similarly, for disposal of dead bodies also, that we will be evaluating the evidence from the other part of the world, and if it is that we can change, that we will be changing it depending on the scientific evidence. And also that we are doing this testing, that PCR testing in the society. Usually that it is that testing is being done around 15,000 per day, and then only that we are detecting these 700 cases per day. So that is only that the Muslim community, that's the Muslim villages that we have identified that in certain areas that COVID-19 that patients small clusters are cropping up, but it is only a small fraction of all the cases that we are identifying. That there are so many cases, for example, out of these 700 odd cases, only a very small number of cases that we are identifying in that manner.
Well, that's the local situation with regard to the pandemic, and now we're going to have a quick look at the global situation. Moving on to Belgium, a Belgian dry ice maker said that it has seen a big rise in demand for its product, with the carbon dioxide-based cooling agent having become key to the transporting of some types of COVID-19 vaccines.
As the world begins to envisage what life with a COVID-19 vaccine might look like, one company in Belgium has seen huge benefits from the rollout. Dry ice maker Artempex said demand for their products started increasing during the summer, as the cooling agent is key to transporting the vaccine. Christophe Quignes is the managing director of the company.
The demand for dry ice started to rise in June, July, when they started talking about the German and American vaccines. Since then, we have had many requests and orders. The turnover is likely to increase in the coming months. It has risen a lot, not quite doubled yet, but it is going in the right direction.
Mais ça a bien monté, pas encore doublé, mais on est bien parti.
The Pfizer-BioNTech vaccine must be transported and stored at minus 70 degrees Celsius, that's minus 94 degrees Fahrenheit. This requires specialized ultra-cold freezers or dry ice. As vaccines are rolling out across the world, the cooling agent is needed in different countries. Quinjes added that the company's main market for dry ice machines are located in Africa, Asia, and the Middle East. The demand has risen, especially for countries that could not produce the cooling agent.
The United States said it authorized the use of Pfizer Incorporation's COVID-19 vaccine on Friday, with the first inoculations expected within days, marking a turning point in a country where the pandemic has killed more than 295,000 people.
U.S. officials gave the green light for use of the COVID-19 vaccine produced by Pfizer and BioNTech on Friday. The Food and Drug Administration said they had authorized the vaccine for emergency use. It's been shown to be 95% effective in preventing the disease in a late-stage trial. The FDA says the vaccine can be given to people 16 and older. A first round of 2.9 million doses is expected to mainly go to healthcare workers and elderly people in long-term care facilities. Shortly after the news broke, President Donald Trump declared it a medical miracle.
The first vaccine will be administered in less than 24 hours. The governors decide where the vaccines will go in their state and who will get them first. The United States is the first nation in the world to produce a verifiably safe and effective vaccine. Today's achievement is a reminder of America's unlimited potential when we have the will and the courage to pursue ambitious goals.
U.S. health authorities, shipping services, and hospitals stood ready to immediately launch a mass inoculation campaign. Both FedEx and UPS plan to ship millions of doses across the country under contract with the federal government. Millions of Americans could begin getting vaccinated this month, especially if a second vaccine from Moderna is quickly approved. That's as the pandemic kills record numbers of people in the U.S. The government has ordered 100 million doses of the Pfizer vaccine, enough to inoculate 50 million people, through its Operation Warp Speed virus development program, and could negotiate for more. The status of those talks are unclear. Pfizer board member Scott Gottlieb said in a CNBC interview earlier this week the company had offered to sell the U.S. more doses as recently as last month, but had been turned down. The U.S. has also agreed to buy 200 million of Moderna's 2-dose vaccines.
In the meantime, a mounting U.S. death toll has tempered enthusiasm about a coming COVID-19 vaccine, with 9/11-like fatalities projected every day for the months ahead, even with a rapid rollout of inoculations, which could start as soon as Monday.
As hospitals around the country prep for the arrival of the coronavirus vaccine, a mounting U.S. death toll has tempered enthusiasm for the rapid rollout of inoculations, which could start as soon as Monday. Another 2,902 U.S. deaths were reported on Thursday, a day after a record 3,253 people died. Numbers equivalent to those killed in the September 11th attacks and greater than in the attack on Pearl Harbor. On Thursday, head of the Centers for Disease Control and Prevention, Dr. Robert Redfield, warned that rate wouldn't be slowing down anytime soon.
Probably for the next 60 to 90 days, we're going to have more deaths per day than we had in 9/11 or we had in Pearl Harbor. I mean, this is really, as I said, this is going to be a real unfortunate loss of life. And the reality is the vaccine approval this week's not going to really impact I think, to any degree for the next 60 days.
In a matter of days, ultra-cold freezer units in hospitals and pharmacies across the country will be storing the much-anticipated COVID-19 vaccine. Susan Mashney is the Vice President and Chief Pharmacy Officer for the Mount Sinai Health System in New York.
This whole freezer can hold like a couple 100,000 doses. We expect we'll only probably get in the thousands initially, and maybe 5,000 doses at any given time at one site.
For Stephen Dohe, Chief Pharmacist Service at Los Angeles County USC Medical Center, the question is, when will vaccine rollout start to turn the pandemic around?
Well, the vaccine is coming very soon, we anticipate. Is it the light at the end of the tunnel? We definitely hope so. That does require, though, that we reach some critical number, the herd immunity numbers. How fast we get there, we'll have to wait and see.
And now a quick check on South Korea. South Korea reported a record 950 daily coronavirus cases on Saturday, exceeding the late February peak of 909, with the president calling on the country's third wave of COVID-19 an emergency.
South Korea's president has warned the country's third wave of COVID-19 is now an emergency after reporting a record 950 daily cases on Saturday. The number exceeded the late February peak of 909 cases, and authorities have warned that they may tighten social distancing restrictions to their strictest level. President Moon Jae-in has ordered the mobilisation of police, military personnel and public medical doctors in an effort to curb the spread of the virus. The surge has been a blow to South Korea's pandemic fighting system, which used invasive tracing, testing and quarantine to suppress previous waves without lockdowns, keeping daily infections below 50 for much of the summer. The third wave comes despite tougher social distancing rules that took effect on Tuesday, including unprecedented curfews on restaurants and most other businesses. The country has reported about 600 cases a day this past week.
In the meantime, Evelia de la Cruz, who strips sheets and sanitizes beds as a cleaner at Roseland Community Hospital in the south side of Chicago, Illinois, says she's proud to be doing her part in the fight against the pandemic.
At Roseland Community Hospital on the south side of Chicago, Illinois, Evelia de la Cruz gets ready for another shift. The 60-year-old immigrant from Mexico puts on her face mask and gown as she prepares to clean the rooms of patients who have COVID-19. De la Cruz was assigned to the COVID ward at the start of the pandemic in March. She told Reuters at her home in a Chicago suburb that she took up the task after many refused because she felt it was her duty.
Yo me siento muy bien.
I feel good working there. I'm happy serving the sick because I know I am doing something good, and that fills me with pride, knowing that I am doing something good for the sick, for the hospital, for the country.
The work of doctors, nurses, and other healthcare professionals has been rightly championed during the pandemic, with people across the globe taking to their balconies at night to applaud medical workers. Yet their ability to work has relied on a less visible category of frontline staff. Janitors and cleaners like De la Cruz, who also risk infection and death but receive far fewer accolades. De la Cruz has been laboring 7 days a week, sometimes for weeks on end. And since the outbreak began, the only time she took more than the occasional day off was in July, when she herself was infected with the virus. A month later, she returned and carried on her responsibilities of disinfecting the coronavirus-contaminated areas of the hospital and keeping patients' rooms clean.
Me da mucho dolor.
Seeing a sick person and not being able to help is very painful. If I were able to, I would. If my hands could cure these people, I would. It hurts me so much not being able to help them, but I can be there serving them and cleaning their room.
De la Cruz, who has lived in the U.S. for 3 decades, says she keeps a vase filled with fresh flowers at all times as an offering to God as she prays for an end to the pandemic.
Well, that's a global update with regard to the pandemic, and now we have more local stories. The electorate conference series of the Sri Lanka Podujana Peramuna was successfully conducted today. Our correspondents say that women have taken part in the event following health protection procedures. The theme of the series has been named as Siudesa Suraki Siuvasara. Steps have been taken to conduct women's conferences in 61 selected electorates in 18 districts in parallel to the fourth party conference of the Peramuna. Founder of the party, Basil Rajapaksa, has decided to postpone the holding of conferences in affiliated organizations thereafter. A decision has been taken to conduct the meetings by strictly adhering to health guidelines, including social distancing. Parliamentarian Geeta Kumarasinghe presided over the women's conference in the Benthara LPT electorate. The meeting was held at the Habrugala area in Benthara. Parliamentarian Gunathilaka Rajapaksa organised the Harispathu Women's Conference at the Buddha Mandala Hall in Katukastota. Former provincial councillor Aruna Gunaratna has organised the Women's Conference in the Mathura electorate. The Seruvavila Women's Conference was held at the Kantale Town Hall. Our correspondent says large numbers of women took part with health guidelines. Parliamentarian Udayakant Gunatilaka has organised the Dadigama Electorate Women's Conference at the Town Hall. The Calcutta Electorate Women's Conference was conducted under the patronage of State Minister Sathasivam Velendran. The Colonna Electorate Women's Conference was also conducted successfully. It was organised by former parliamentarian Sani Rohana. Women's conferences are scheduled to be conducted in many districts tomorrow as well. The SLPP instructs its organisers to hold the meetings under strict health conditions and guidelines.
Minister Johnston Fernando has ordered the officials to immediately complete construction of the highway from Kadawathu to Mirigama. The previous government of good governance had given contracts for commencement of constructions. The minister says that, however, these constructions had not been carried out appropriately. Minister Johnston Fernando made these remarks participating in an inspection tour in the portion of the highway from Kadawathu to Mirigama yesterday. He was accompanied by Chairman of the Gampa District Development Committee, Sahan Pradeep, and officials. Minister Johnston Fernando said that the contract had been given within 3 months former government assuming power. He further said that it has become very clear that many inappropriate transactions had been conducted. The minister further said that they are conducting inquiries in this connection. He further said that the President and the Prime Minister provided necessary funds for construction during a difficult period. The minister added that 7.5% out of the 15% of funds earmarked for the project has been delivered. The minister further said that the construction of the part of the highway from Mirigama to Pothuhara will be completed before the 31st of March.
Suspicions were raised at the Presidential Commission inquiring into Easter Sunday attacks today over any connection between former Minister Rashad Badiuddin and granting bail on the physician at the Kurunagala Teaching Hospital, Shafi Sahabdeen, who has been accused of engaging in infertility surgery. The matter has come into light with the giving of evidence by Senior Superintendent of Police Mahinda Dissanayake, who was in charge of the investigations. He told the Commission that former Minister Badiuddin, on the day of the granting of bail to physician Shahabdeen, had called him and asked whether he was satisfied. Media person of the BBC Sinhala service, Shirley Upul Kumar, testifying before the Commission, said that he had edited the interview on the former President Maithripala Sirisena by his media institution without distorting in any manner of its contents. He also said that the former President had stated in his BBC interview that he was unable to accept responsibility of the Easter Sunday terror attack. Former President Maithripala Sirisena, in his discussion with the BBC Sinhala service on the 14th of June this year, had stated that he was not prepared to take over the responsibility of the Easter Sunday attack. However, in his testimony before the Presidential Commission recently, the former president had stated that the BBC Sinhala service had changed the contents of the opinions expressed in his interview with malicious intent. As a result, the media person Shirley Upul Kumara was convened to give evidence before the Presidential Commission yesterday. Upul Kumara added that the former president had requested him to ask any question from him and that the interview was conducted in a normal manner. He added that, however, the former president was upset when he inquired from him on the Easter Sunday attacks. Yet, the former president participated in the discussion till the end without expressing his feelings. Upul Kumara added that after the interview, the former president put an arm over his shoulders and posed for photographs. He has shown these photos to the Commission. When the witness was inquired whether he had distorted in any manner of the contents of the recorded interview prior to the release to the internet, he has replied saying only sounds and repetitions had been deleted. The questions and answers were not altered in any manner, he said. Shirley Upul Kumara, in response to another query, said that neither the former president nor his parties had made any impact on him not to publish the interview. He further said that the interview appears in the website and Facebook of the BBC Sinhala service even today. The President's Commission has also interrogated today Mahinda Dissanayake, who was the Senior Superintendent of Police in charge of the Nuwara Division, regarding the conducting of the Shantipura training camp in Nuwara by the extremist group headed by Zahran Hashim prior to the Easter Sunday attacks. He replied that as the SSP in charge of the Kurunagala Division, he had conducted the inquiry on the instructions of the DIG. He added that the course of the investigation was it was proven that there was a connection between Shafi Sahabdeen and Rishad Badiuddin. Details has also revealed that of a private medical institute owned by Shafi during this period. Further information pertaining to an Indian national of Arabic origin assisting this medical institution has also been revealed. It has also been found that a sum of 440 million rupees were circulated in Shafi's account within a short period of time. Shafi had told them not to ask any questions regarding the accounts. The witness said that they became suspicious of Shafi's utterances and decided to look into the origins of the fund. He added that later on he came to know that the monies had been earned through 8,000 cesarean operations conducted. The outcome was the prevention of childbirth. Later on, the physician was arrested. He also said that during investigations, he had told DIG that he had received transfers, and SSP Mahinda Disanayak also said that later on, the physician Shafi received bail, and following day, Minister Rishad Badiuddin had called him and asked to find out whether he was now happy.
Director General of Agriculture M.W. Veerakun says that measures have been taken to control the spread of army worm disease. He points out that therefore the farmers need not have any unnecessary fear regarding their crops. Farmers say their maize cultivations have been severely affected by the rapidly spreading armyworm menace in Rajarata. Maize or corn have been extensively cultivated in several villages, including Horivila, in the Palugasvava Divisional Secretariat Division. The farmers point out that thousands of acres of cultivations have already been destroyed by the disease. They add that the caterpillar is inflicting more harm to their crops during this season than in previous occasions. The armyworm is damaging the crops during night time, and therefore application of whatsoever amounts of chemicals is of no use. The farmers request the government to look into the problem and to provide speedy solutions. Around 25,000 hectares of maize cultivations in Gangeaya Habarana, Palugasvava Kakirava and Galembiduruvava have been affected. The farmers have been tormented by the Sena caterpillar disease for a period of around 2 years. Our correspondent says farmers in track 7 and 8 in Mahavilachia, Anuradhapura were also affected. More than 200 acres of crop cultivation have been destroyed.
Well, the government says that a decision has been taken to maintain the Ministry of Justice in the existing building itself. The Justice Ministry issuing a communique says that, however, measures have been taken to shift the Supreme Court and the Court of Appeal to an alternate location for the purpose of expanding these institutions. The ministry communique adds that this decision has been taken after several rounds of discussions. The number of judges in the Supreme Court and the Appeals Court have been increased by 14 under the 20th Constitutional Amendment. This measure was taken in addition to the government procedure to transform the process of granting justice in a more effective and productive manner to the general public. Accordingly, it has become an emergency requirement to provide space and service facilities such as new judiciary halls, office chambers and registries for the newly appointed justices. It has been pointed out that nearly 500,000 cases had been piled up in the magistrate courts in the island by the latter half of last year. In the district court, there were 200,000 cases which could not be resolved. Similarly, there have been 25,000 unresolved cases in the High Court and 11,500 cases in the Court of Appeal. The Justice Ministry also says that nearly 5,000 such cases were at the Supreme Court. The government is taking measures to resolve the issue within the next 5 years. The ministry report further says that certain irresponsible persons were attempting to give a wrong definition due to the misunderstanding or the other intention on the program unleashed with the objective of handing over a more productive service to the people. The ministry reiterates that it condemns the act of sabotage by not supporting but raising unnecessary issues regarding the program to create a country with a future vision.
The Livelihood Development Committee meeting of the National Programme to Uplift Rural Economies centering on the Galle District was held today. Today's discussion was conducted under several fields including agriculture, samurdhi, wildlife, transport, lands and tourism. A special emphasis has been made on the land dispute in the district. Ministers, government officials and others participated in the discussion.
And moving on, the preliminary workshop of the Sri Lanka Army Electrical and Mechanical Engineering Regiment was established at the Army camp premises in Kosgama today. Army Commander Lieutenant General Shavendra Silva has presided over this event. Well, this workshop has so far been conducted at the regiment headquarters in Saint Island, Colombo. The 75th anniversary of the Army regiment also falls on this day. A line of armored cars was produced and renovated at the preliminary workshop for the United Nations peacekeeping operations were displayed. These vehicles were equipped with devices to safeguard the soldiers from landmines, claymore bombs and RPG attacks. An artificial intelligence-driven commander vehicles has also been modernized by the regiment. It is comprised of a camera network, remote control drone, aerial technology communication facilities as well. The 17th commemoration of the late Venerable Gangadavila Somathera was conducted at the Sri Vajragnana Dharmayatane in Maharagama today. An almsgiving for 17 bhikkhus was also conducted under the patronage of the chief incumbent of the Dharmayatane, the Venerable Maharagama Dhammasiri Thero. The Sri Lanka Handicraft Board has decided to introduce an array of domestic consumer goods under the Luxala brand name. The first state of the project got underway at the Luxala showrooms in Tumulla in Colombo today. The program is being implemented as an alternative to the problem faced by local handicraft arts and due to the collapse of the tourism industry. And on that cricketing hype, it's time to end the news. Do enjoy the rest of the programs. Take care and good night.
Have a pleasant night.